Hi, today is the first official day of Scleroderma Awareness Month. Scleroderma is a rare disease, mainly affected in women, that hardens the skin and tightens the connective tissues. My name is Kingsley Hunter, and I'm here today. Today we're here with Miss Laverne, so she can tell us her experience with the disease and to spread awareness. So Miss Laverne, tell us your story and how you got diagnosed.
I was diagnosed a little over 2 years ago, maybe. At the time, the doctor didn't really tell me what scleroderma was. So I thought it was like a simple skin disease, like eczema or something like that. But scleroderma, if you will excuse the expression, I call it the devil's disease, because it literally takes your abilities away from you. Normal skin, it sheds so the new skin can grow in. With this disease, the old skin does not shed. The body just keeps making more skin on top of what's there. So it restricts your movement. This is why my hands are the way they are. This is the best I can move them. The skin around my neck has scleroderma also. So right now I have a lot of pressure around my neck. Feels like somebody's choking me. This is not fun. On top of the doctor not immediately telling me what scleroderma was, by the time I was diagnosed, from the time I was diagnosed to, it took them like a year to actually put me on medication. So by that time, this disease had a good hold. It has changed my life drastically, because it's hard for me to do things for myself. I can't brush my hair. As you can see, I can raise my hand up to my head, but I can't do nothing once I get there, because my hands are the way they are. Can't bathe myself. It's a lot of things that all the bazillion things that you do with your hands and you don't think about it, I can't do. Because as you see these claws. On top of the scleroderma, I have severe arthritis, especially in my neck. So the bones in my neck are bent down because the arthritis has made the bones in my neck curve down in an abnormal fashion. This is why I cannot hold my head up. So those two things together, bones in my neck and the skin disease, is actually torture. A lot of people assume that I'm in pain, and I know I look like I've been in pain. I'm really not. It's pressure. Very, very uncomfortable. Just imagine somebody holding their hand on the back of your neck, mashing your head down so you can't lift your head, and at the same time they got their hands around your neck, your throat, trying to choke you. That's what I'm feeling right now. This is not an easy disease. And you have to take responsibility for your health. Don't just automatically accept everything the doctor tells you. If you got questions, ask them. But it's a lot of things I can no longer do right now. I can't brush my teeth because I can't hold my head up, which means I can't gargle. All the kids, when you whine about having to brush your teeth, trust me, try going a whole year without brushing your teeth and see how you feel. Not being able to take proper baths every day or showers. It's more than just being stinky, which sounds funny on the outset. But when your body goes for a long period of time without being cleansed, it can result in real physical issues also. Medical issues that you don't even think about. So and then sometimes you get depressed because where you're used to doing things for yourself, now you gotta wait for somebody to do them for you when you don't want to, but you don't have much of a choice. Right now, I'm trying to hopefully get to Riverside. They have a Scleroderma clinic, and by the grace of God, get some help with this condition so I can get my quality of life back. This is no fun. Trust me, it's not. So, I mean, that's pretty much it in a nutshell. Oh, I also have, there's two kinds of scleroderma. One is called systemic. Second kind is the kind where it only affects the skin. I have the systemic kind. That's the kind that can infect your organs also. Your heart, your lungs, your kidneys. Any organ in your body. I have the kind of scleroderma that can affect your organs. Yeah. So, I mean, that's pretty much it.
First, I want to say thank you for taking the time to conduct this interview and spread awareness. Can you elaborate on the treatment you receive day to day?
Right now, the only treatment I'm receiving is God's grace and mercy. I'm not on anything, not on any medication, not by my choice. A whole bunch of, if you excuse the expression, whole bunch of crap that I have to go through with the doctors, with my insurance, a lot of other things. Right now, I'm not taking anything for this condition. And it scares me because I need to be on something. I do not want to shrivel up like a prune. I do not want to go out of this world in this condition. I pray every day that my quality of life be restored, even if it's not 100% like it was, but a lot better than what it is now. But dealing with the doctors, they have not done a whole lot for me. Right now they say they don't want to restart my medication without me doing a physical visit. Right now it's hard for me to get out of the house because I need help to get up and stand. I have to walk with a walker. And there are steps outside the apartment which is hard to get down steps on a walker. So right now, I'm not being given any treatment. Not for the scleroderma. A home health aide since January. Hello. Hopefully I will get that soon. Supposed to start by the 1st of September. And I'm supposed to get a home health doctor that makes home house visits starting in September. The reason being, somebody messed up my Medicaid. The Medicaid had to be redone, and it's supposed to start the 1st of September. So, we shall see.
What message do you want to convey to the medical professionals or anyone dealing with the disease right now?
Don't leave your patients in the dark. You know the patient has this condition. Don't wait. Let them know what they're dealing with. Start treatment right away. Don't wait, because I'm telling you, this devil's disease does not wait. Get on it as soon as possible. Educate your doctors, your nurses, your nurse practitioners as to what scleroderma is and what it can do. When this disease first started showing up in my hand, started in this finger, this index finger, I could still move my hands, but I noticed that my finger was getting hard and tight. I didn't know why. I asked the doctor, I said, can arthritis do this? Because, I've had arthritis for years. I asked the doctor lady, can arthritis do that? Her response, well, I don't know, but your hands are so smooth and pretty. Like, woman, that's not what I asked you. Second doctor came in, I asked him. Same thing. He was like, do your hands hurt? I said, no, they don't, which at the time they did not. That's all he said. When my neck started bending and they started taking x-rays of my neck, and they saw that my neck was starting to bend. They showed me the x-rays, told me my neck was bending. If you see your patient's neck or something like that is starting to mess up, please suggest a brace. Because I think if I had worn a brace back then, when my neck started to bend, that would have kept it straight. Do you think they said, Miss Laverne, we see your neck is going a little wonky, we're going to put a brace on it? No, they didn't suggest that. They suggested nothing. Of course, I didn't think of it. So, you all, God placed doctors here, physicians, nurses, nurse practitioners. He gave you all the knowledge to help people. You get paid a decent salary to do your profession. Don't leave your patients in the dark. You would not want this happening to you or somebody in your family. Why do you think other patients want to be treated like that? Learn about it. Help your patients. Don't don't be stupid and dumb and try to put a band-aid on a burn, because that's not going to help it. It's not. And to patients, I say, you're the one that's got to deal with this condition. Don't be afraid to ask. Don't be afraid to demand. Because you're the one that has to deal with this condition, not them. I mentioned to one doctor, I left another doctor because I didn't think they were helping me. So the other doctor was like, well, let me get an opinion from another doctor, because I don't want to step on anybody's toes. I said, honey, I don't care if you stomp on somebody's toes. I'm the one that's got to deal with this condition, not the doctor that you don't want to offend. Okay? I need a second opinion, and I need it now. Don't be afraid.
Thank you, Ms. Laverne, for sharing your story and spreading awareness about this rare disease.
You're welcome.
As we were conducting this interview, I couldn't help but notice this painting on the wall. And it seems as though Ms. Laverne has a huge talent for painting. So do you want to elaborate on that passion that you have?
Yeah, I was a professional artist. That painting I did back when I was in college. And some years later, I redid it. But before this happened, I was a professional artist. Art was my passion. I miss doing it. But yeah, I was a professional artist. I'm praying, I'm hoping that I can get back to it again someday. Even if I can only get one hand to working, it'll be worth it to me. But yeah. This disease doesn't just affect you personally, it also affects your family members. My daughter, I have the best daughter in the world, but it's hard on her because she's not used to seeing me like this. And she does the best that she can. She has a job also, an outside job, but she does the best she can, which I think is excellent. But again, just keep in mind that this is your health. Don't be afraid to ask questions. And there are good doctors out there. But just make sure that you're taking responsibility for your own health. Yeah, I thank you. Thank you for listening to me. And God bless you. God bless you all.
This concludes our interview with Ms. Laverne. If you'd like to reach out and show support, the contact information will be down below. Like and share this video. Thank you and have a good day.